Yes, absolutely. By the way, Ryan, it's recording, so I was gonna like show who's here, but I went, all right, no, no worries. Yeah, I'll say that I'm also joined here by Ryan, JJ, Bobby, and Morag, who are all part of this space. So we're joining you from a wellbeing space in Wester Hales, which is run by and for the people. And here we have Care Cafe, which grew from a basically like care workers in the area having like it's not like I really like everything you say, Elizabeth. Like the way you speak is like just it's really moving and it really resonates and it's an experience that a lot of people have, so it's really powerful to share about it. And yeah, I remember you saying about the unsociable hours, but it's also for a lot of people like these like shifts where you'll have like time between shifts where you have to travel, where you're not paid for that time, but it's not enough time to do anything. And we live in a world where there's like very few free public spaces, and this is one of them. So care workers were taking their breaks here, and out of that formed Care Cafe, which is a space where people can come to talk about to just come and to be, and it's for anyone who has an experience of care, if that's working in care, being in receipt of care, or actually what is the most common for people who join is like being denied care or being denied the right kind of care. So it's a group of people that's quite expansive. It includes like almost anyone, and uh, yeah, we meet here and do things to create a caring space together, but also talk through issues in social care, share experiences, share tips. It's a space where people can kind of come together as equals across like um, care staff, people in receipt of care, and it's really powerful. And in the run up to this meeting, we've been kind of writing and speaking and preparing, and I want to thank like everyone who's here and also everyone who's kind of fed into it and contributed to it, because we normally meet on a different day. So today there's people who have like fed into it and contributed but who aren't with us. So just like massive thank you to all of Care Cafe and you guys having us and all of the speakers. Um, I have like some collection of writing that people have been doing, like in the run up to this, and we've been sort of like writing about it in creative ways. And I want to start with kind of what some notes from a conversation that I had with someone called Eunice, where I asked, what does care look like? And she started speaking about poverty. Like the first thing that she said was poverty. And she said that cafes are social spaces where you can go and you can keep warm and where you can connect to people and where you can socialize, and that's care. And if you can't afford to go to a cafe, if you can't afford um, a cup of tea or even the transport to get there, then you become isolated. And we live, like she was speaking about, living in a world that doesn't have care. And she spoke about transport, about the cost of taxis to a hospital, about the cost of travel for carers. Because yeah, while people are doing all of these shifts, like all over with like unpaid breaks between them, which aren't really breaks because you're needing to travel, you're also needing to pay for the travel. Like a day of care work like that time without also like also with having to pay for travel and also with like needing to be able to eat yourself and everything, like it's a wonder that you come out of it like without having made a loss, to be honest. And uh yeah, she also said, so she spoke about what inhibits care, she spoke about poverty, but she also said that care in the community is respect, love, being there and making a difference. Ali spoke with us about like being an unpaid carer for her son and the struggle that that was. One of the things that she said to me was that like I became disabled from being a carer. So like Elizabeth speaks about backbreaking work for her, like you're right, like it's literally like she was caring with no support, but also like the effect it has on your emotional health and on your mind as well. Caring whilst being isolated is is not care. And yeah, she said I had to demand constantly. She had to advocate for herself and for him. She said it wears you down. She said some people don't have that confidence or don't speak the same language, so you also have to go through these like bureaucratic loopholes. She said we need to break away from the system, which I thought was really, really beautiful. We also heard from Brian, who was given a when he was young, because of his vision, he was also given a misdiagnosis of having learning disabilities, which then at the time they also called like the term was like handicapped, and so he's like fought against those terms all his life, but also still now experiences like issues with care. And he said, I felt I'd been put in the wrong structure, which was no help going forward in life in the near future and causing much stress in the community, and it can create many mental health problems. We did some work thinking about the title of this event and just the reality of life, of care in crisis, and we thought about what crisis meant and what the opposite of crisis could be and what a care system based on that could be. And we did some sort of mapping of these things, and this was done with Callum and also with Eunice and with some other people. Yeah, come on. Hey Dan, welcome. Just to let you know, we're on Zoom and it's being recorded at the moment, just to let you know, so you're very welcome to join and sit down, but we're just sharing some of the stuff we've been working on in Care Cafe.
Yep, great.
It's good to see you.
Good to see you, babe.
I can share also, so this is some words that we drew out that was the opposite of crisis that we think a care system could be based on. Sleep. To have enough. To have anything rather than nothing, but we deserve everything. Advice, rest, ease, relief, someone who's able to fix things, people and friends, money, being rich, having comfort, support, help, happy-go-lucky. We need time, we need company, we need political change. So this is some of the things we've been speaking about. We also actually did some work, like Care Cafe, who meet here. We went outside. Oh yeah, by the way, we're in an empty unit in a shopping centre, which is no longer empty because we transformed it. So we went out into the shopping centre and asked people what care meant to them. And someone wrote something really beautiful. This is someone who used to be a nurse in Pakistan, but over here her qualifications aren't recognised. So whilst we have a shortage of nurses, she isn't able to do that, and it's something that she would really love to do. But she said, care means to love with passion. When we care for either elderly or anyone, it doesn't mean to look after. It is very necessary to be in the heart. So yeah, I wanted to share just some of these collections of voices as a way to just like really show like the expansiveness of care, and especially at a time when there's a consultation ongoing about a national care service in Scotland. And like when I ask people about care, they start talking about public transport, they start talking about cafes, about poverty, about mental health, about all of these things, and just thinking about like that we can be expansive and that this is an opportunity, and that like this is an opportunity to think about isolation and care and what could be different and what does community care look like and what could it be, and just like spending time together as people who care or experience care. Like I think it's really clear that those are the people who have the wisdom and the like expertise and the passion to build it and make it happen. So I think like whilst we have this crisis in care, but whilst we have what I see as an opportunity, even though like I have a lot of cynicism of how that is going and how we can be part of it, I think it's really clear to me that we need like a national care service, but also a democratized care service between people who care, people in receipt of care, people who are currently denied care. And I think that that is a group that's expansive enough to mean everyone. Like transport is care, cafes are care. So let's see it as that, and let's build a care service that has that understanding, but also has like the people power. Because this has been such a powerful experience leading up to this meeting. So thank you all. Thanks.